is Tara Summers, and this is my head-to-toe physical assessment. The first thing I'm going to do is I'm going to come in the room, I'm going to wash my hands, and I'm going to introduce myself to the patient. I'm going to provide privacy, close the curtain, close the door, make sure that she's comfortable and that she has something to cover her throughout the assessment. Going to introduce myself. My name is Tara. I'm going to be your nurse today. I'm going to do a mini mental assessment. I'm going to check her level of consciousness. I'm going to assess her affect, her speech, her general responses. Just kind of get a good feeling for her mental status. What is your name?
Sierra.
And what day of the week is it?
Sunday.
And where are we right now?
In my house.
In your house. Okay. All right. Awesome. So I've washed my hands, and the first thing I'm going to do is I'm going to look at her skin. I'm going to assess for color. I'm going to assess for warmth. I'm going to look for any bruising, any lesions, any wounds, and the skin assessment will continue throughout the examination. Okay, so then I'm going to assess the head and the scalp. I'm going to assess the size, the shape, symmetry, and then I'm going to palpate the scalp. I'm going to assess for any lesions, any bumps, bruises, any knots, any pain or tenderness. Check the hair for texture and, again, moisture. Now we're going to move on to the eyes. I'm going to assess the eyes for placement and for symmetry. Eyelashes, eyebrows, the sclera, the lacrimal glands. Look up. Perfect. Okay, just to check for any discharge, any redness. Okay, we're going to check your eye movements. Look at my fingers. Look beyond my fingers. Look at my fingers. Look at the wall beyond my fingers. Okay, good. Now follow my fingers with your eyes and nothing else. Okay, awesome. And I'm going to check your pupils. Just look straight ahead. Just make sure that they react to the light. Do it on the other side. Perfect. Okay. Next thing I'm going to do is I'm going to inspect the nose. I'm just going to look at it, just check the structure, the bone structure. Check for patency on both nostrils. Good job. Okay. Make sure there's no discharge. I'm going to palpate the sinuses, the frontal sinuses and the maxillary sinuses. Do you have any pain or tenderness when I do that? Okay, good. Okay, next thing I'm going to do is I'm going to inspect the ears. Again, for symmetry, for the shape. I'm going to look for any discharge or any unusual coloring, any redness or swelling. I'm going to palpate. Is there any tenderness? No? Okay, perfect. Okay, check your nerves. Can you puff up your cheeks? Okay, lift your eyebrows. Perfect. Okay, and then I'm going to inspect the mouth. I'm going to inspect the lips and the oral mucosa. Make sure that it's teeth and check for any broken or missing teeth. I'm going to check the tongue. Stick out your tongue. Awesome. Okay, I'm going to check the uvula, make sure that it's symmetrical in the throat. Okay. Okay, awesome. Thank you. Sorry. Okay. Any pain or tenderness in your mouth? Any problem swallowing? Can you swallow for me? Okay, awesome. Okay, and then I'm going to check the let's take this off. Okay, I'm going to check the lymph nodes, preauricular, postauricular, the cervical chain, submandibular, submental. And I'm going to palpate the neck, palpate the trachea, make sure that it's midline, and try to feel the thyroid, make sure it's not enlarged. Okay, we'll check your nerves. Push up against my, perfect, head side to side. Awesome. Okay, good job. Okay, then the next thing I'm going to check is your chest. So go ahead and hang your legs over the side of the bed and sit straight up tall. I'm going to check for symmetry on the posterior of the chest, and I'm going to listen to the lungs. Just take some deep breaths for me. Good job. Okay. And check for symmetry. When you take a deep breath, go ahead and take a deep breath to make sure that it's symmetrical on both sides. Okay, go ahead and sit back up. Like, there you go. Get back up. Good job. Okay. And now I'm going to listen to the lungs in the front. I forgot to do the whisper test when I was checking for your hearing. Let's do that really quickly. Sorry.
Book.
Okay. Good job.
Movie.
Good job. Okay. Okay, so I'm going to listen to the lungs in the front. Okay, awesome. Okay, then the next thing we're going to do is we're going to palpate the heart, see if I can feel any thrill, any bruit, and then I'm going to listen to the heart. And listen to the apical pulse. Say listen for a full minute. Okay. Now I have to inspect your abdomen. You're going to have to move your hands. Okay, so we're going to inspect the abdomen, and I'm going to look for any, again, lesions, bumps, bruising. And then I'm going to auscultate normal bowel sounds, 5 to 20 in each quadrant. And you want to listen before you palpate, because you don't want to. Okay, so first we're going to do gentle palpation. Is there any tenderness? Any pain? Just ticklish? And then deep palpation. Does that hurt?
No.
Just tickles? Okay. All right, good. All right, now go ahead and stand up for me. Actually, wait, before you stand up. Sorry. You can touch your nose and then touch my fingers. Again. Okay, good job. Now stand up. Okay. Did I have you lean over and check your spine? Make sure that it's aligned. Okay, perfect. Okay, stand up, look at me. All right. Close your eyes. Okay. Try to maintain your balance. Okay. One more time. Good job. Squeeze my hands. No, but there you go. Okay, good. Very good. Okay, now get back on the bed. Okay, and then I want you to take the heel of your right foot and put it on your left leg. And go from your shin to your ankle. Good job. Now do it on the other side. Awesome. Okay. We're all finished. This was my head to toe assessment, and thank you for your time.